Hello, I'm Keith Robinson. I'm a pediatric lung doctor here at the University of Vermont Children's Hospital. I'm here today to talk to you about asthma. We hope that the videos we share with you today will help you keep your asthma under better control. In these videos, we will cover asthma, your medications, asthma symptoms and what you can do in an emergency, triggers and how to avoid them, and managing your asthma. The information in this video is not to be used in place of your doctor's advice. Please call your doctor with any questions and concerns about your asthma. Before we start, you can access the ACT or track to measure your asthma control. These are simple questions that will help you measure your own asthma control. By adding up your score and comparing it to the tool's cutoff point, you can determine if you have controlled asthma or poorly controlled asthma. However, some people can't always feel their asthma symptoms. That is why it is important to check in with your primary care provider or your asthma doctor to get lung function testing or PFTs. Lung function tests can sometimes detect subtle problems with asthma that people can't feel. After watching all 4 videos, you can complete the ACT or track again to see if your asthma control improves. You can use this tool as often as you wish. If you have poorly controlled asthma, you will want to be sure to follow your asthma action plan, take your medications as prescribed, and contact your doctor if your asthma remains poorly controlled. Your lungs are like 2 balloons that fill up with air when you breathe in. The most important things your lungs do is to bring oxygen in from the air to your blood so your body can make energy. Breathing starts at the nose or mouth. When you breathe in, the air travels down your windpipe and into the smaller airways in your lungs. The airways look like tree branches that become smaller as you go further out. The smallest airways lead to tiny air sacs where your body takes oxygen in to your blood. The small airways are the part of the lungs where asthma can be a problem. What is asthma? Asthma is a chronic lung condition that causes breathing problems. And while you may have it most of your life, you can learn how to better control it so you can lead a healthy and active lifestyle. Asthma causes breathing problems because the airways of the lungs swell, the muscles around the airways get tight, mucus builds up in the airways of the lungs and clogs them, just like your nose gets clogged when you have a cold. Here are 3 pictures of lungs, and under the lungs are pictures of airways. If you look at the first picture, the lungs and the airways look healthy. The second picture shows lungs and the airways starting to swell. The third picture shows the lungs and the muscles around the airways getting tight and the mucus building up and clogging. The airway here is much smaller than the airway in the first picture, making it more difficult to breathe. When you're having breathing problems, you may feel like your chest is tight, cough, especially at night, have shortness of breath, wheeze, or have trouble breathing or coughing with activity. Let's talk about what to do if your asthma keeps getting worse. You can see in the picture the muscles around the airways getting tight and the mucus is building up and clogging. This is what your airways look like when you're having an asthma attack. If you took your rescue medicines as your doctor told you and you're still getting worse instead of better, please call your doctor right away. Call 911 or go to the nearest emergency room right away if any of these happen. You can't reach your doctor, or you don't have one, or you're getting worse instead of better after you took your rescue medicine. You're having trouble walking or talking. Your lips or fingernails turn blue or gray. Your skin between your ribs or at the neck is pulled very tight or sucks in. Please note some special considerations for babies with asthma. Babies with asthma who are having an asthma attack may have trouble eating or drinking, fast breathing, work harder to breathe, have poor activity, or have blue skin or pale skin. You should go to the nearest emergency department or call 911 if this happens.